Hi guys, I just wanted to take a quick minute and explain to you these mock scenarios you have coming up here. So the purpose of the mock scenarios, as it says in your syllabus, and you can see the syllabus language here on your screen, the purpose of this is to give you an opportunity to demonstrate both decision making as well as clinical skills and patient interaction all at one time in simulated environments. And so that's the real purpose of this. We're going to have a simulated patient. Sometimes it may even be on real patients if we can find somebody that matches that aspect. But you're going to go through and going to basically give care to this mock patient. And so really the care that you provide is going to be real, just the patient is what's mocking. And you can see here as well, some of the grading as far as that goes through. You're going to be graded on your decision making, basically your ability then to show and demonstrate appropriate decision making. Basically, are you able to figure out what you need to do? And do you do this in a logical way with a little bit of flow to it, so you're not going back and forth? You don't have your patient getting up and down and all over the place. It makes sense as far as why you did it. And then do you do it with a little bit of speed and efficiency? You'll also be graded just pure on your execution. This is similar to your test offs with execution sort of aspect with that. Do you perform the skills that you select appropriately? So whereas the decision making is more, did you select the right skills? The execution then is how well you performed those skills. As everything, you're also graded on your ability to interact with your patient. This is both giving clear and reasonable explanations as well as answering questions, as well as demonstrating a certain amount of confidence in what you are doing. Lastly, you're scored on your reflection, and we'll talk about that here in a sec. So the easiest way is just going to be to explain to you by your first mock scenario. And so since this is new, I wanted to give you actually what your mock scenario is going to be, as well as the instructions, so you can somewhat prepare. So you're going to sign up for a mock scenario time. And this time is when you will actually be performing the mock scenario. You need to arrive at least 10 minutes prior to the mock scenario and plan on staying at least 10 to 15 minutes after your scheduled time ends. The reason for showing up at least 10 minutes prior is because at 10 minutes, you will actually go to the lab door, and taped on the lab door will be a sheet of paper. It'll be probably just a small sheet of paper with your name and the time on it that you can grab the sheet of paper. And that sheet of paper will include your preparation and concept mapping information. And so each time, this first paragraph here is exactly the same, no matter the mock scenario. So I'll read that to you and explain it. You have 10 minutes to think through this case before your assigned time. As part of this 10 minutes, it is strongly suggested that you think through potential treatment options or skills that you might need to perform based on the patient presentation. Include in your thinking what your findings might mean for the next step of treatment. Create a flow chart of possible evaluation methods, results, treatments, and outcomes. So basically, you have 10 minutes now to cram based on the little information that you have. And so in this case, the little information that you have is you're providing athletic training coverage for a high school basketball game when a frantic mom grabs you from behind. You recognize her and know that in addition to her daughter who is playing in the game, she also has a middle school son. She is barely able to explain that her son is choking on some popcorn in the hallway and asks you to go check on him. So in this 10 minutes, what we're talking about as far as creating a flow chart and understanding what the next steps of treatment might be. We see that we have a middle school kid who is apparently choking. So we need to start thinking through, how are we going to take care of a choking kid? So you might quickly look up treatment parameters for a choking kid, figure out what those are as far as things go through. Then where the flow chart needs to come into play is, well, we don't know, is the patient going to be conscious or unconscious when we get there? What might we need to do if they start conscious and go unconscious? How might we use other people that are around? What sort of things will we need to do as far as activating emergency procedures? What equipment might we need, and what equipment might be available? Or what might we have to do if we are missing certain equipment that we're usually used to having? All these are sorts of things. You don't need to really write it down unless that's helpful for you. You only have 10 minutes. Use it as best as you can. But you are going to start to think through this. The real purpose of this is so that we don't waste the mock scenario having you completely unprepared. So we want to give you at least 10 minutes to cram so that you don't walk in there and completely freeze. So once it's your time, we will come get you, and you will come into the lab. The first part for the lab will be the orientation. And this orientation paragraph that you see here is the same regardless of what your mock scenario is. All right. There are a few differences that might change as far as the location of the patient or different aspects that you might need here. Otherwise, this beginning and middle and end is all the same. So for this one, it's take a second to orient yourself to the equipment available for your use in the room. All equipment that you need has been provided. Do not pretend to use other equipment. You must make do with what is available. Where the patient currently is a sideline to the main practice field. He is off the field and continues without any danger to the patient. The area where the equipment is located is the remote athletic training room inside the football stadium, out of the elements. The emergency plan calls for this venue, calls for use of a cell phone to activate EMS. The physical address is 101 South Main Street. So, obviously I have the wrong patient information there because you're at a volleyball tournament, but that doesn't really matter. It's not worth starting this video over, so I apologize. But basically yours will say that you are at a concession stand. There'll be bystanders around, use for that as far as you know through. But the important thing is, as you go in, there will be equipment available there for you to look at and to use. You will also have taped off areas where you need to stay in because these are video recorded. And so you can only use what's in the basic scenario space. The important thing is use what you need. There will be things there that you do not need, but don't try to make things up. So in this case, if there is a pocket mask, you could use that. But if you don't have a pocket mask, what might you use instead? There might be a face shield there. You might end up doing either breathless CPR or go ahead and do pure mouth to mouth as far as that goes through with pinching the nose. So far, and whatever you want to do with that. Again, you make the decision. It's important for you to make the decision on what you're going to do and have it make sense for what you need to do. All right. The next part, again, this is the same no matter what. As for the situation, the scenario proceeds in real time. Do not pretend to fast forward time. If the situation calls for continual monitoring or treatment, proceed as you would normally do. You don't need to explain to the examiners what you're doing. However, you should explain to your patient. You should perform all skills as if this is a real case. Assume that all evaluation treatment findings that you find on the patient are real and the examiner will let you know if something is different from what you see or feel. If there is something that you want to observe, just say what you are looking for, and the examiner will let you know if it is present. It is possible the examiner may call a timeout to substitute in a mannequin or other simulation device. However, assume that this will not happen and begin instructing your patient what you plan on doing and proceed unless a timeout is called. Once you have completed your care for this patient, you may indicate that you are finished. Otherwise, you will be notified when the scenario is ended. So obviously a lot of information there, and we will read this to you. Basically, you have this amount of time to kind of look around, and then once we are done reading this, you'll have 3 more minutes before we start to ask basic questions on the equipment or what you've read. You cannot speak to the patient or get any additional information, but if there is some confusion on where things are as far as the tape off things, different aspects like that, this is when you would get to ask. But let's go through and see, talk more about what this all means. Right? As far as time, you need to assume that this is real. Right? There is no fast forwarding time or anything like that. So if, say, your treatment, you're doing an ice bag and the plan is for them to ice and elevate, for example, go ahead and ice and elevate, and if they continue, if the plan is for them to sit there, then they sit there, and you just either talk with them, check with them, whatever you would normally do. If that was real, do that. Don't say something like, okay, it's been 20 minutes and you're ready to go. Right? Assume that time goes in real time. Also, you don't need to talk to the examiner. Right? We will be there as well, mainly running the camera, different aspects, but you need to speak to your patient. So obviously, you're going to start by either introducing yourself, or a lot of times you can just say, hey, what happened? What's going on? Something like that. Either one, but an introduction, especially for situations where you don't know your patient, an introduction on who you are, your training, qualifications, things like that might be helpful. In this case, you know the parent but not the kid, and so you can go ahead and get started and introduce yourself to the kid. Right? You also need to assume that everything that you do and you see is real. Right? So let's say that you're doing and you're checking to see whether or not this person has a pulse or not. So you're going to check the pulse, and if the person has a pulse, then you assume that that is true and they have a pulse. The examiner would let you know if there was anything different. Right? The only exception might be with that is if you want to observe something. Say, I'm looking for a blue, is there a bluish tint to the skin that might indicate choking? Different aspects like that. Is there swelling? Is there deformity? Different things like that. Ask the examiner to let you know what you're looking for, mainly because observation is a quiet thing. Explain what you're looking for, and the examiner will either show you a picture of what you are seeing, or will describe it for you if needed. It's also possible that we may need to substitute in a mannequin or other simulation device. If that's the case, we will totally control that and let you know. We'll just say timeout and bring in the mannequin, say this is now your patient. Go ahead and proceed. Otherwise, just continue. So like in this case, if the patient was to go unconscious, so to speak, the patient would go unconscious, and opposed to doing chest thrusts on our mock patient, we would call timeout and put the mannequin in. However, in the meantime, if the patient were to if you start with a conscious patient and the patient attempts to go unconscious, just continue. You need to lower the patient down, right? Even though go through and just get ready for chest compressions, just like you would assume that it's real until that timeout is occurred. Lastly, what's going to happen is if you finish, oftentimes the scenario may go and be on a timer where we'd ask you to finish, but most of the time we try to give you enough time to complete whatever we expect for you to do, and so you can just say, okay, we're done. So like if you're taping an ankle or different aspects like that, and you're done and complete and it's time to let them go, you say you're letting them go. Otherwise, we may say it's ended, where like EMS shows up and takes over. So the patient information here says, as you approach the scene, you see the patient lying flat on their back. There is no immediate danger to yourself or the patient. He appears to be unconscious and is turning blue. A crowd is gathered and are all looking for you for direction. So in this case, patient's lying flat, apparently unconscious, and you're going to start providing care. So you'll provide care until you're done. Once you are done, you will then get the mock scenario student reflection. Basically, you're just going to immediately, when you're done, answer a few questions. The first one is about your level of confidence before, during, and after. So this is the idea if I was really nervous, I didn't feel like didn't know what was going on, or I was really confident, really felt prepared. You describe that during and then after. Obviously, confidence may change as far as things go through. Next, you'll describe 2 or 3 things that you felt you did well or you did the best during the scenario. So it could be, I felt like I had really good patient interaction. I felt like my chest compressions were really good. I felt like my heel locks were good. Whatever it is that you felt good about. 3 then is obviously the opposite. 3 things that you can improve on or that you didn't do so well. 4 then is, what sort of changes might you have made if you could go back and do it? If there really weren't any changes, what other alternatives might you have done? So there's always different things that you could do, maybe slight alteration to the procedure, a slight change in something, or a different approach. That's where you would describe. And then lastly, with 5, this is where I would like you to develop some sort of plan. What are you going to do to use this information and approve? So the idea is whether it's going to be look on notes, practice more, talk through it. You will be getting feedback in a little bit of time. It takes us a while to grade all the videos, but you'll be getting some feedback as well. But I want you to start thinking about what you can do to get better. Well, that's basically the mock scenarios. If you have any questions, feel free to ask myself or one of your instructors, and talk to you later.